Try to avoid lying on your back while you are pregnant. After about the 4th month, lying on your back puts the full weight of your uterus and baby on the inferior vena cava, or IVC. This vessel carries blood from your lower body back to your heart. The pressure of a pregnant uterus on the IVC reduces blood flow to the heart, which decreases blood flow to your uterus and the developing baby. Lying on your back also puts pressure on your spine, back muscles, and intestines. Lying on your side takes the pressure off the IVC. Your heart pumps blood through arteries to deliver oxygen and nutrients throughout your body. The blood returns to your heart through veins so that it can be pumped to the lungs to pick up more oxygen. When blood is in leg veins, it is working against gravity to return to the heart. Blood pressure in veins is low, so there are valves in the walls of the veins to prevent the blood from flowing backward. Leg muscles contract to squeeze the veins and help pump your blood back to the heart. Some people's legs have large ropey veins. Called varicose veins, they are large because they are always expanded. The blood in these veins is having a hard time returning to the heart, and pressure from above, the force of gravity, on the column of blood forces the thin walls of the veins to push outward, making the veins bigger. An enlarged varicose vein contains more blood, and this also puts pressure on the valves in the veins, which can cause them to fail. Changes during pregnancy can promote the development of varicose veins. The pregnancy puts more pressure on the veins in your legs and pelvis. To support the developing baby, the volume of blood in your body is increased, but blood flow from your legs to your pelvis is reduced. Hormonal changes can also contribute and increase the elasticity of blood vessel walls. When varicose veins occur during pregnancy, they often resolve on their own during the months after delivery. What is a baby's world before it is born? Some might say it is the placenta, which provides protection and early immunity, delivers nutrients and oxygen, and removes carbon dioxide and other waste. But beyond what the placenta provides, some other remarkable things are happening as the baby's senses develop. The embryo is touching and feeling the world around it by 5.5 weeks. First as its lips and nose touch the wall of the uterus, and then extending to the rest of the body. The sense of taste also develops early. By 9 weeks, the fetus can taste some flavors, and after 13 to 15 weeks, the taste of amniotic fluid changes constantly based on what the mother eats. A developing baby can also hear. Most of the sounds are the movement of its mother's stomach and intestines, and blood running through her blood vessels. But a developing baby can also hear voices from outside the womb. By 24 weeks, a baby recognizes and is calmed by its mother's voice. And by 28 weeks, the baby's sense of smell takes in odors from things the mother eats or inhales, which pass from her blood through the placenta to the amniotic fluid. Even the baby's sense of sight might be getting stimulation from some light coming through the womb, especially when the mother is in bright light. In addition to hearing, tasting, smelling, seeing, and touching, the baby is also practicing walking in the uterus. The mother feels these as kicking movements, and by the 3rd trimester, a sudden movement by the mother will cause the baby to fling out its arms and legs as if losing its balance. A baby's brain grows rapidly during the last trimester of pregnancy, triples in size during the first year after birth, and continues to develop rapidly throughout the first 2 years of life. Fat makes up more than half of the brain's dry weight. A primary fat in nerve cells of the developing and infant brain is docosahexaenoic acid, or DHA. One important role for DHA is as a component of myelin, which covers nerve fibers. Myelin ensures that nerve impulses move quickly and correctly. With less myelin, impulses travel more slowly, delaying movement of information from one cell to the next. There is also a high concentration of DHA in the junctions between nerve cells. Nerve cells communicate across these junctions called synapses. Peak formation of synapses begins at 34 weeks gestation and continues through the first 24 months of life. DHA is also a primary component of nerve cells in the retina, the light-sensitive tissue lining the inner surface of the eye. DHA is a member of the family of omega-3 fatty acids. Essential fatty acids, or EFAs, must be obtained from your diet. Cold water fish, a traditional source of dietary DHA, get DHA from algae in their diet. However, many fish today are farm-raised and fed corn and soy meal, and only wild salmon and trout consistently supply DHA. Breast milk, unlike cow's milk, contains a significant amount of DHA. Levels depend on the mother's diet. Other good sources are foods fortified with algal DHA, which comes directly from algae, and algal DHA supplements.